Scenario 3. You are being dispatched to a 45-year-old male with a headache.
All right, perfect. So scene safety, BSI. What am I seeing?
You find a 45-year-old male patient conscious and sitting in the kitchen table with a bucket at his right side. You smell vomit.
All right, perfect. So I'm going to begin assessing the patient. So there seems to be one patient. I'm going to see if there's any C-spine issues. Sir, do you have any head, neck, or back pain?
No.
All right, perfect. So since he's talking with me, he has a patent airway. I can visually look to see if he's breathing fast or slow. What's your respiratory rate, sir?
It's going to be 20.
20, okay, perfect. At this point, sir, my name's Corey. I'm here to help. I'm going to assess his pulse, skin temperature, and then I'm going to have my partner get his vital signs and blood glucose and lung sounds.
So you get a blood pressure of 162/100, pulse of 110, skin is pink, warm, and dry, temperature is normal, and you get patient is alert and oriented ×3, responds appropriately when to questions.
Okay, perfect. All right, so pulse is a little bit high. Blood pressure seems to be a little bit high, but within normal limits. Do I get a blood glucose level in there? I'm sorry.
114 blood glucose, and you have a 98% saturation.
Okay, perfect. So those are good vital signs. Sir, can you tell me what happened? I see that there's vomit in the bucket. Do you have any head, neck, or back pain?
Sudden pain in the head.
Okay, and what were you doing? So I'm gonna, at this point, I'm gonna go through sample and OPQRC. Sir, what were you doing when this pain started?
Just reading the newspaper.
Just reading the newspaper? Okay.
It began about an hour ago.
It began about an hour ago. Awesome. At a scale of 1 to 10, 10 being the worst pain you've ever had in your life versus a 1 being no pain where you're walking around, how would you rate this pain?
8.
An 8. Okay, and can you describe the pain for me?
It's sharp.
It's sharp pain on an 8. Does it move anywhere?
It does not.
Is it the front or the back of your brain, or is it just a whole area?
The front.
The front, okay. All right. And what did you say you were doing? You were just reading, huh?
Reading the newspaper.
Okay. All right. So visually, I've got my signs. He's told me my symptoms. So at this point, I'm going to ask for allergies. Sir, are you allergic to any medications?
Just bees.
Okay. If you don't mind, I'm going to have my partner hook you up to a monitor real quick. I'm going to put these 4 stickies on you to check and see how your heart's doing. Is that okay?
That's fine.
Perfect. All right. So while he's doing that, I'm going to go medications. Are you on any medications, sir?
Just EpiPen as needed.
EpiPen for the bee stings. Okay, that makes sense. When was the last time you had something to eat?
About an hour and a half ago, and it was just breakfast.
Just breakfast? Okay, perfect. And we've already covered the events that leading up to it, and you don't have any pertinent medical history. All right, perfect. At this point in time, I would reassess his vital signs, so I already have a baseline, so that I'm going to see where his reassessment leads us. So at that point, it's blood pressure, respiratory rate, SpO2. We don't need a necessarily blood sugar because that's not going to change. We're also going to check eyes if we didn't check those before, so that's going to be pupillary constriction or dilation.
Blood pressure of 160/184,
Okay.
pulse of 110, respiratory rate of 20. Patient becomes alert oriented ×2
Okay.
with a saturation of 98%.
Okay. So at that point, you were originally a 3, and now you've gone to a 2. Sir, we're gonna, if you don't mind, we're gonna go to the hospital. If that's okay with you, get you checked out. Your mentation is a little bit different. Do we have pupil constriction or anything like that?
You have unequal pupils.
Unequal pupils, perfect. Does it say left or right?
Right's 6 millimeter and left is 4 millimeters.
Okay, perfect. All right. So with the change in mental status and the visual changes in the pupil, we're gonna go down. He's gonna become an unstable patient, so we're just gonna be a rapid transport. So vital signs would now go from every 15 minutes to every 5 minutes. And then at this point, if ALS isn't here or we have advanced ALS coming from an ILS standpoint, we're going to go down an intracranial pressure, maybe with a rapid onset, maybe a stroke in the brain. So at that point, we can go down and give you the Cincinnati stroke scale. Sir, can you put your arms out in front of you, close your eyes?
Yes.
All right, perfect. Is there any drift?
Neuro exam is symmetrical.
Symmetrical, okay, perfect. And then we would do a face, and then drift, face, drift, and then the speech. Obviously, if he's speaking with me, then we're good. So at that point, we're going to move to the ambulance if we're not already there. We're going to get a repeat set of vital signs. see if those change.
Blood pressure is 166 over 110.
Okay.
Pulse of 110. Respiratory, 110. Pulse is respiratory rate of 20. Patient now becomes alert and oriented times 1.
Okay.
Lung sounds are clear and bilateral.
All right, perfect. So at this point, again, we're going to be transported to the hospital. It seems to be localized, some sort of intracranial pressure or swelling, rapid onset. So definitely like a stroke or a TIA, could be a fall or something like that we didn't catch initially. So yeah, at that point, yeah, we call the hospital, treat with diesel and rock and roll.
Yeah.
Perfect.
Perfect.
Cool.
You just got that last 2 seconds.